Hello, and welcome to this continuing education module. My name is Alexis Gomez, and in this video, we will define CAUTI, identify the prevalence of CAUTI in long-term care facilities, talk about possible barriers to prevention measures, and finally, look at CAUTI preventions that can be used in your facility. What is CAUTI? CAUTI stands for catheter-associated urinary tract infection. CAUTI is one of the most common healthcare-associated infections. Many people get UTIs, but what makes CAUTI different from a normal UTI is that the infection was caused by introducing a catheter into the urinary tract. Doing this increases the risk for pathogens to enter the urinary tract and cause infection. CAUTI prevention is a national patient safety goal that applies to all healthcare facilities, whether it be acute care hospitals or long-term care. In fact, Centers for Medicaid and Medicare Services evaluates the number of residents with indwelling urinary catheters and the number of residents with CAUTI infections. This data, among more, is used to develop the facility star rating. So, implementing CAUTI prevention measures can improve the facility ratings, but more importantly, it improves patient safety. Although CAUTI is more frequent in acute care hospitals, it is still prevalent in long-term care facilities and should remain a priority. 13% of residents are admitted to facilities with an indwelling catheter already in place. About 5 to 22% of residents acquire CAUTI while in long-term care. The number of residents with indwelling urinary catheters increases the risk for infection. 17 to 69% of catheter-associated urinary tract infections could be prevented if prevention measures were implemented. When 500 nursing homes participated in the AHRQ safety program to reduce CAUTI infections, facilities reported a 47% drop in CAUTI reports. CAUTI can have very serious consequences, especially for the geriatric population. CAUTI has been linked to several things like increased morbidity and mortality, prostatitis, polynephritis, kidney abscesses, urethral stricture, multi-resistant bacteria, bacteremia, mechanical trauma, and increased confusion in residents. There are many barriers to implementing any new program. In this case, we are going to review a few possible barriers facilities might face when trying to implement CAUTI prevention measures. Lack of staff and physician support is one barrier. Lack of nurse or physician champion. This means there is no one pushing and encouraging the team to implement or adhere to the program. Management may not prioritize CAUTI prevention measures. This means that the management may not be enforcing CAUTI preventions, and it influences staff to not prioritize it as well. Staff turnover and low staffing can also be difficult because it is very difficult to keep training new staff on CAUTI preventions. Also, it can increase workload and stress when staffing is inadequate. Other possible barriers to CAUTI prevention measures is knowledge and skill deficiencies in aseptic technique, proper hand hygiene, catheter care, and maintenance. Having staff do annual skill trainings or evaluations can improve these deficiencies. Lack of communication. Reviewing why catheter is still in place at the time of admission, asking if the catheter is still needed or can it be removed, identifying how long the catheter has been in place, and delegation of catheter care. All of these items need to be clearly communicated with other nurses, providers, or UAPs to improve patient safety. Having an indwelling urinary catheter increases the risk for infection because there are many entryways for microbes to enter the urinary tract. Some pathways for microbes include upon insertion of the catheter into the urethra. The part of the catheter that remains exposed can form biofilms, and bacteria move up the catheter into the urethra. Having kinks or obstructions in the closed tubing system can cause pooling of urine and bacteria, and contamination of the tubing can occur if it becomes disconnected or if the drainage bag is not properly emptied. All of these items can introduce bacteria into the urinary tract. One of the first steps we can take to prevent CAUTI is to assess the need for an indwelling urinary catheter, because it should only be inserted and kept if absolutely necessary. Some reasons for indication of an indwelling urinary catheter in long-term care residents are if the patient has acute urinary retention or bladder outlet obstruction, to assist in healing of an open sacral or perineal wound in incontinent patients, to improve comfort for end-of-life care if needed. Indwelling catheters should not be utilized as a substitute for toileting program for an incontinent resident or for obtaining a urine sample on a resident who can voluntarily void. Another tool we can use to prevent or identify CAUTI quickly is to know some signs and symptoms to look out for when caring for a patient with an indwelling catheter. These include fever, shaking chills, hypotension, confusion, functional decline, and increased leukocytosis, costovertebral angle pain or tenderness, suprapubic pain or tenderness, pus around the catheter insertion site, acute pain, tenderness, or swelling of testes, epididymis, or prostate. These symptoms may indicate a catheter-associated urinary tract infection and should be reported immediately. If an indwelling catheter is indicated, utilizing proper technique when inserting an indwelling urinary catheter reduces the risk of infection. When inserting the indwelling catheter, be sure to perform hand hygiene before and after you begin and complete the procedure. Follow your facility protocol on how to perform catheter insertion using sterile technique. Be sure to secure the catheter to the leg using an anchor to prevent movement and urethral traction. And ensure the drainage system is closed, free of kinks and obstructions, and placed below the bladder. Proper hand hygiene is a basic skill, but an important aspect of reducing infection. Here are the steps needed to perform proper hand hygiene using soap and water and alcohol-based hand sanitizer. When using soap and water, wet hands with clean, warm water, applying the amount of product recommended by the manufacturer to the hands. Rub hands together vigorously for at least 20 seconds, covering all surfaces of the hands and fingers. Rinse hands with warm water. Dry hands using a clean disposable towel. Turn off the faucet with a disposable paper towel. If using alcohol-based hand sanitizer, apply the product to the palm of one hand. Rub hands together. Rub this product all over the surfaces of the hands and the fingers until hands are dry. Using proper hand hygiene before care of the patient improves patient safety by reducing risk of infections. It is important to perform hand hygiene before and after any patient care. However, in this case, we will pay attention to particular times to perform hand hygiene as it pertains to CAUTI prevention. It is best to perform hand hygiene and don or doff gloves immediately before and after inserting or discontinuing an indwelling urinary catheter, accessing the drainage system for any means, emptying the drainage bag, or collecting a urine sample. Also, keep in mind that if your hands are soiled, it is best to use the soap and water method for hand hygiene. The drainage bag can be a site where bacteria forms due to pooling of urine, so it is important to care for the drainage bag properly. When caring for a resident with an indwelling urinary catheter, be sure to empty the drainage bag regularly. Stabilize the catheter tubing and drainage bag to prevent any kinks or obstructions. Always keep the drainage bag below the level of the bladder and off the floor. And be considerate for where to place the drainage bag based on what the resident will be doing. A great acronym to remember or post in your facility is CAUTI to stop CAUTI. C stands for catheter removal to remind providers and nurses to remove the catheter as soon as possible. and assess if inserting the catheter is even needed. Remember, if no resident has an indwelling urinary catheter, then the risk for CAUTI infection is eliminated. The A stands for aseptic technique. If inserting a catheter is indicated, then be sure to follow strict aseptic technique to reduce the risk of microbes invading the urinary tract. U stands for using regular assessments for residents with indwelling catheters. This means to keep track of how long the catheter has been in place and follow up with the provider frequently to see if or when the catheter can be removed. T stands for training on catheter care. Getting annual skill evaluations and trainings on catheter care ensures staff competence and improves patient safety. Lastly, the I stands for incontinence care planning. If the patient is incontinent of bowel and has an indwelling urinary catheter, it increases the risk for CAUTI infection. So it is best to create a plan to minimize the time the resident is soiled. Here we will look at a summary of some do's and don'ts to prevent CAUTI infection. Do use soap and water for period care. Do ensure tubing is not kinked or obstructed. Do keep drainage systems closed. Do replace catheters and drainage bags that become disconnected. Do place resident identifiers on collection containers. Do disinfect port before obtaining urine samples. And do track the duration catheter has been used and recommend discontinuation if possible. Some don'ts are: don't change catheters and drainage bags routinely. Don't give prophylactic antimicrobials. Don't clean periurethral areas with antiseptics. Don't clean periurethral area vigorously. Don't contaminate catheter outlet valve during collection bag emptying. And do not routinely screen for asymptomatic bacteria. CAUTI prevention measures are important to implement in long-term care facilities. However, it can be a daunting task. To relieve the workload, be sure to work as a team and enlist help when inserting or caring for an indwelling urinary catheter to ensure proper technique is being used. Do not be afraid to delegate catheter care to CNAs or UAPs who have the proper skills and training. Use clear communication to your team members and provide clear expectations on how and when you want your catheter care to be done, and to notify the nurse if there are any concerns with something. Give and receive feedback to improve outcomes by being supportive and providing constructive criticism. Lastly, empower your team to advocate for resident safety. CAUTI infection affects residents in many ways, and it is our duty to provide quality care.